Office of Health Strategies press conference on Connie. My name is Kerry. I'm chair of the Insurance and Real Estate Committee, and I'm honored to be here to talk about Connie. Right at the start of the 2023 legislative session, we're getting a lot of asks for streamlining our medical records to help with prior authorizations. And we're here today to tell people that we're moving towards that direction of patient care and better quality through Connie. This team up here is going to share their experiences with you, and this is something that Connecticut can be proud of. I'd like to introduce the ranking member on the Senate side, Senator Tony Wong.
Thank you, Madam Chair. And this is truly a bipartisan effort in focusing on how Connie, and every time I hear Connie, and I have to explain to people, it's not a movie, but one where it's an incredible collaboration of forming a collective, an exchange of healthcare data information that engages with all the shareholders, as well as providing patient access to information. So ultimately, the bottom line about why Connie is so important, why we're here today, is it will increase efficiencies in regards to cost, but also better medical care. And ultimately, isn't that the goal for everything that we want to be able to do in the industry that we're in? I think the other critical element that I want to emphasize is the fact that Mark Raymond, the CIO for the state of Connecticut, has been intricately involved in the design of this program to ensure that healthcare patient data privacy is maintained and that the exchange, even though it is free-flowing among multiple shareholders, is protected from cyber attacks and violations. So I'm excited to be part of this process and support of this. And I want to introduce now Dr. Gifford, who will be instrumental in implementing and maintaining this. But I also want to also acknowledge Victoria Beltre, who initiated this plan to bring it to fruition. But ultimately, it's the people that you see here that will make it work. So, Dr. Deidre Gifford.
Good morning. Deidre Gifford, the Executive Director Designee for the Office of Health Strategy. I want to say thank you very much to our colleagues in the legislature, Representative Wood, Senator Wong, and all of the committee members for prompting us to hold this event to better inform you, the public, of our statewide health information exchange and the progress that we're making. And I really appreciate you, Senator, acknowledging my predecessor in this role, Vicki Beltre. She was really a driving force in standing up this effort and so many other efforts at the Office of Health Strategy. I have big shoes to fill in this role, so appreciate the recognition of her and her leadership on this program. So as you have heard, Health Information Exchange has a great potential to help us achieve better care at lower costs. You know, there's a saying in healthcare quality improvement about getting the right care at the right time in the right place. And better access to information is really critical to that. You're going to hear from some of our partners in the healthcare industry this morning about the potential that Connie has to help us achieve that goal. And you're going to hear from our experts from Connie and OHS on the program about some of the details about provider enrollment. We're really here today to talk about the importance of providers getting engaged in Connie, and that's kind of the critical first step that we need to achieve in order for Connie to reach its full potential. And I wanted to talk about two things in particular that we're focusing on in Connecticut, which makes us a little bit unique with respect to providers. There are two parts of the healthcare delivery system that have sort of been left on the side of both the electronic health record movement as well as statewide health information exchange. And that's the long-term care sector and the behavioral health sector. Both of those sectors are critical when it comes to care coordination and information sharing. You talk about leaving a hospital and going to a nursing facility, for example. You talk about a home health care nurse who's trying to provide the best care she can to somebody in their home. who needs access to real-time, accurate, and good information about medications and diagnoses and latest treatments. And then you're talking about behavioral health providers, many of whom are treating people who have co-occurring physical health conditions and whose mental and behavioral health really impact one another. And without good access to information, it's more difficult to coordinate care and to provide the best care at the right time in the right place. Senator Wong mentioned our work on protecting privacy, and that is super important when it comes to behavioral health. And having served on the board of Connie in my previous role at the Department of Social Services, I can tell you that's an intense focus of the work at Connie, and we're building on the experience of other states who have built very important safeguards into the data exchange. So we want to maximize the benefits while protecting privacy. So I'm delighted in my new role at the Office of Health Strategy to be the sponsoring organization for Connie in the state. I'm going to introduce now the individual from Office of Health Strategy who has been a terrific leader on this effort. And he is our State Health Information Technology Officer, Sumit Sajnani.
Thank you, Dr. Gifford. Good morning, everyone. As Dr. Gifford mentioned, I do serve as the Health Information Technology Officer for the state and also the chair for the Connie Board of Directors. And I thank you all for being here on this important topic and getting the message out. I think over the last two decades, there has been a clear transformation from paper charts to electronic health records. Record number of providers now in the state, including smaller organizations and solo providers, are using EHR systems, which has been a significant advantage for providers and for patients, but it also has created silos around health data, particularly for patients that see multiple providers across different health settings. So after addressing this, or trying to address this issue, and having a lot of stakeholder engagement, which has included patients, patient advocates, providers, payers, and the Health Information Technology Advisory Council, Connecticut did establish the Health Information Exchange, the only official statewide health information exchange, which has Connie. Connie is set up as an independent nonprofit organization, but under the administrative oversight of the Office of Health Strategy to provide an appropriate guardrails. Connie was deemed operational in May of 2021, which is going to be a critical milestone. And as others have talked about the need for providers to connect, there is a time frame associated by when providers need to begin the process of connecting. But before I get to that, a lot of the work that has been done around Connie, and Jen Searles, the executive director of Connie, will speak to the accomplishment, particularly give you some stats around what Connie has been able to successfully do in connecting providers. It has already started to change the care coordination landscape. It's been integrated into the workflow for providers to increase greater communication on the care coordination team. It's also started to increase greater communication between providers and between patients. We will obviously hear from providers' point of view on Connie, and I think if it's not compelling enough after you've heard from all of the speakers up here why you should connect to Connie, I did want to point out the statute that also requires providers to connect to Connie. But before I get to that, let me also address some issues around the benefits that go beyond. It's not just what the statute requires providers to do. I think there is a value proposition here. And the value proposition is, if you can get patients more involved in your care, research shows that those patients are better advocates for their own health care. So one of the mandates that Connie has is to connect all providers across the state and make available electronically, securely, the complete medical health information for all patients at all care settings. That is a pretty big mandate, and that does require providers to connect. It will also provide patients, at no cost to the patients, electronic access to their health information. It is voluntary for patients to participate in the HIE, but it is not voluntary for providers to connect to the HIE. I will just read a small part of the excerpt of the statute related to this, just so I don't get it wrong. Each healthcare provider with an electronic health record system capable of connecting to and participating in the statewide health information exchange shall apply to begin the process of connecting to and participating in the statewide health information exchange. Now, if you happen to be a provider that does not have an EHR system, there is a requirement for you to have secure messaging so you can communicate with other providers on your care team and make sure that you can communicate about your patients with them. But wait, there is more. For those providers that may not have EHR systems, to connect with Connie, there is a portal that is being offered which will allow you to look up your patient's health information on that portal from other providers that might be feeding in those records. So clearly, the value proposition and the potential around improving health outcomes and reducing inefficiencies is great. With that, I will turn it over to Jen, who will speak to you about the successes so far. Jen.
Thank you, Sumit. I am so thrilled to be here. The intent of the legislature when this was first passed in developing statewide HIE by and for Connecticut, and with Connecticut stakeholder representation all up and down the governance structure, was to really ensure that our patients and providers had secure access to critical healthcare information that would enable them to make better, more informed healthcare decisions. Thanks to our healthcare partners, some of who are going to talk today, we are well on our way to achieving that goal. All of the acute care hospitals in the state have committed to connecting to Connie, and close to 3/4 of them are already providing at least one data feed into Connie. Altogether, we have 365 individual data feeds contributing clinical healthcare data on more than 4 million unique patients in the HIE. And close to 700 users at our state's leading healthcare organizations are securely accessing Connie to get timely clinical data to help them as they deliver care to our state's residents. With the help of our advisory committees that are made up of Connecticut's clinicians, pharmacists, healthcare administrators, and patients, Connie has rolled out innovative use cases and technology, including image sharing and the best possible medication history. We're going to continue to innovate on new use cases like e-referrals, emergent imaging share, and advanced directives in our quest to enhance the health and well-being of the state's residents. And though we've hit a number of key milestones since we got started in May of 2021, as Sumit pointed out, we're not done yet. Healthcare doesn't just happen in our acute care settings, and in order to ensure that we meet the goals set out for Connie, we've launched outreach efforts to capture primary care, specialty physician practices, pharmacies, labs, and skilled nursing facilities, to name a few. Our teams are working hard to engage with as many licensed Connecticut providers as possible to teach them about Connie, educate them about what it means to connect, the benefits of connecting, because I think there are many, and you'll hear from some of the providers today about that, creating awareness of the mandate and explaining how Connie can help. And though I've gone through facts and figures and all of that, that's not really what motivates my team and me every day when we get up. What really motivates us are the stories that we hear. So for example, we hear stories of patients whose care could have been improved. And let me be clear, we have amazing healthcare organizations in this state. But all of this can be eased when data is shared among treating providers. We've also heard from providers who lament the time their staff spends on chasing down mammogram reports or colorectal cancer screenings that don't make it to their office. And we've heard anecdotal evidence from many provider organizations about the time that has saved for them and for their staff so they can provide great patient care. I'm excited for the future of Connie. I know we're going to make our goals of getting all of the healthcare provided or connected. And with that, I'd like to turn it over to Dr. Al Valeran from Nuvance Health.
Thank you, Jen. It's a pleasure to be here. Good morning, everyone. I am Dr. Al Valeran, Vice President, Chief Medical Information Officer for Nuvance Health, and also co-chair of the Connie Clinical Advisory Committee. It's my pleasure to discuss the importance of Connie to our patients and our clinicians in Nuvance and across Connecticut. We've been using Nuvance since the summer of 2021, when we completed a full connectivity to one of our hospitals in Sharon, Connecticut by the deadline September 30th. Since that time, we've grown a network health information consent form for all our patients. We've expanded the Connie portal to all our facilities and clinical staff, and integrated medical images and enhanced our clinical viewer in our EMR. The burden of gathering healthcare patient information is not the reason why any of us went into healthcare. Through technologies like Connie, we deliver the value of care for all our patients, which is accessible throughout our network. Before our practices used Connie, there was a lot of frustration, inaccurate diagnoses, and potentially delays in care because the information just wasn't available to our practitioners. As an emergency physician, if you are unconscious in front of me, I have no idea what's going on with you unless I can access that information. Today, Connie gives me the ability to take care of you, an unknown you, in my emergency department through Connie, so I can get the best care possible in a rapid manner without having to call anyone else. We now focus on the patient, not on our struggle to obtain the patient's information. Connie provides a platform for understanding the complete patient, and our abilities to clinically communicate is now automated. Connie facilitates that vital link between patient and clinician. We have leveraged the upcoming primary care connectivity requirement to make a smooth transition process for all our referral and non-employed primary care facilities so that our patients, anywhere that come to us, get the facilitation of that information back to their primary care provider wherever they go. By reducing the antiquated and burdensome use of faxing and paper, Connie is a critical access point for our success at Nuvance to facilitate our anti-faxing network initiative, to reduce that burden that drives burnout and the egress of employees from healthcare itself. Thank you very much.
Good morning, everyone, and thank you for being here, and thank you, Representative Wood, for the opportunity to share our story with you. I am Dr. Neetu Kashyap. I am a primary care physician at Yale, and I specialize in clinical informatics. A big mouthful to say, but deals with technology related to healthcare, and I serve as the Associate Chief Medical Information Officer for the Young Haven Health System. Our journey with Connie has been, been early partners with the Connie development. I serve on the Clinical Advisory Committee with the GEMS leadership, and also co-chaired the best possible medication history use case for Connie. That has successfully been launched a few months ago. Our early partners in the Connie journey, and yes, I will say that we all went in with optimism, a trepidation given our prior experience, but we will say that we've had a great competitive advantage to this space, and we've done some great work together, and there's a lot of potential going forward. We have been sharing data with Connie, which is how it all starts. If people don't share data, there isn't data to go across, and the single patient story doesn't come together. I will focus our story and our journey on one particular part of Connie portals that is called the Connie Alert. And our care coordinators have been using that for about 6 months now. What that does is that if a patient that is followed by one of our care coordinators is seen anywhere across Connecticut that is sharing data with Connie, our nurses get notified that that patient has been there. Now, keep in mind, who are these patients? These are the sickest of the sick, oftentimes, patients with complex medical conditions who seek care from different clinicians and may actually be in and out of the hospital a lot. So getting the full picture, the full story, that's what Connie has been able to afford for us, as well as real-time notifications for our nurses, who then have the ability to reach out to the individual or to the care team, and then be able to get a complete picture on what's going on, assist them to a safe transition back home, schedule any follow-ups, assist in medications, do some medication reconciliation, And we're really looking forward to when the skilled nursing facilities, as Dr. Gifford pointed out, and the long-term care agency, that black box gets opened up for us. Thank you very much.
Good morning, everyone. My name is Danielle Abraham. I'm an ED physician, and I serve as the Regional Chief Quality and Safety Officer for Trinity Health of New England. Trinity Health of New England includes St. Francis Hospital and Mount Sinai Rehab Hospital in Hartford, St. Mary Hospital in Waterbury, Johnson Memorial Hospital in Stafford Spring, and also Mercy Medical Center in Western Massachusetts. In addition, our ministry includes physician practices, network of ambulatory services, home health, and also post-acute services. We're nearly over 10,000 healthcare providers in Connecticut and Western Massachusetts committed to being a healing and transforming presence for those in our community we serve. I would like to thank you for the opportunity to be here with you and also share with you some of my thoughts on the benefits of Connie and the HIE for us collectively in the state of Connecticut. Our Trinity Health of New England hospitals have been well on their way with the engagement with Connie. We started this journey more than a year ago, and now we're really connected and ready. We are in our hospital across Connecticut. We are going on a new EMR, as it's called Together Care, and we will go live very shortly, in less than 2 months, across our hospitals in Connecticut and also Western Massachusetts. And at that time, in the March of, or the middle of March of this year, the data will start flowing across in the HIE. Now, Together Care, powered by Epic, that's the instance of the EMR that would be on. It's a great example of the unified one medical record for the patient across the continuum of care. Now, now I'm going to offer you a little bit more on an update we are with Connie, why Connie we believe it's a great value in Connecticut. We currently view a big need, a large gap in around where patients are seen and when they're seen, how this information flows to the caregivers timely. So we believe that the HIE and connectivity with the HIE will add a great value for the following reasons. We believe that the quality of the care will be better, the care will be safer, the experience will be appreciated on the consumer and also the community member better, and also we believe also will have impact on cost, reducing costs. And the reason for that is the following. Connectivity to the HIE will afford us real-time awareness of the patient journey and the episode of care across the continuum. And that information flows to the care team across the continuum. The second one is it will align us all with updates on patient's condition, whether they're acute or chronic, on their medication list and also their allergy. And then the last one is will give us the ability to also review most recent lab results and procedures, because that awareness will hopefully result in reducing duplications of repeat tests that are unnecessary. Overall, we feel the value of connecting to the HIE in our state through Connie and Connie's help will afford us all to take care of our patients in a more, what we call member-centric experience. We'll be able to care for them across the continuum and across various care settings. Thank you.
Thank you to all the speakers. This is truly an exciting time for healthcare in Connecticut. I do want to recognize the Vice Chair of the Insurance and Real Estate Committee, Jill Berry from Glastonbury, who's here, and open it up to questions at this time. Any questions?
Yes, when is the deadline to sign on, and what's the consequence for providers that don't?
Thank you for that question. I should have covered that in my comments. I talked about the May 2021 being the date when Connie was designated as being operational. And the reason that's an important milestone is 2 years from that date is the deadline for all providers to begin the process of connecting with Connie. It was broken out in 2 separate milestones. The first year, May of 2022, was for hospitals and labs to connect to Connie, and now May of 2023 is for all other providers to connect to Connie. Our focus right now, you asked about what if providers don't. I think the product that is being built is going to be such an indispensable part of the care coordination that I think providers are gonna want to connect. And my focus right now is to encourage providers to connect, give them the support that they need to connect. So I encourage and invite all providers that haven't already done so to begin the process of connecting with Connie. Thank you.
Are there any data sharing agreements in place right now outside of the hospitals, for example, universities, with the insurance companies, any of those?
We don't have any with universities, UConn, obviously, UConn Health, that may be the universities that signed that. We do have data sharing agreements with payers. One of the stakeholders named in the legislation for Connie is that we need to assist payers. And when you think of what payers provide sometimes in care management, there's a real need for them to be able to have access to data so that they can manage patients' diabetes, as an example. I also was talking to Representative Wood. One of the use cases that I think is very compelling for Connie, and one that we want to explore, is helping providers with prior authorization. So if we can streamline that data and information, that would then enable them not to spend hours on the phone filling out forms, trying to get more information to validate that prior auth. I think there's a very solid case there that could frankly lower costs overall and streamline care for patients.
And would it be an option for other companies or corporations outside to pay a fee and be part of that data sharing, or are there limits to who can be part
There's
of this?
limits, right? So the underlying foundation for all of this is federal and state laws, and specifically HIPAA, right? So that governs what we can and cannot share, and with whom we share it and how we share it. And then we layer on top of that the data sharing agreements, a privacy security committee user provision. So no, if Bob's mechanic shop wants to get access to data, that's not a HIPAA covered reason why they should have access to it.
Okay. And is Connie self-sustaining right now financially?
Connie is not self-sustaining right now. Part of the plan was through a contract with the Office of Health Strategy. We are working our way to sustainability, but we've been up 2 years now, have a ton of momentum, and so I see that happening in our future.
And that sustainability would come from the data sharing agreements?
It would come from Connie being a couple different ways. There are still, I think, the federal government through ONC and CMS still has a great desire for interoperability. And so to the extent that we can do things like help Medicaid with data sharing and providing value there's opportunity for federal funding in that way. Certainly services that Connie provides can be a potential avenue. So for example, with the Department of Social Services, we're helping build a portal for their home and community-based services. You heard Dr. Gifford talk about some of the fringe healthcare organizations that maybe weren't included in meaningful use dollars and the like. And so to enable them to get access to critical clinical information so that they can help patients meet their goals, we're building a portal to enable that specific view. So those kinds of services are well within the plan for Connie.
Okay, last question, and I'll let you go. But you gave a couple of statistics before about the number who had signed up. Do you have a sense of how many percentage-wise that is with the number of total providers or the number of total individuals?
So that is, when Connie is up and running, yes, I'll be able to give you that information because it is surprisingly a challenge, right, to get that kind of information. So we tend to look at provider organizations, and our goal is to get to a critical mass of provider organizations, which we're defining as sort of 90% of the hospitals. We're about 75% of the way there. We'll be there by March or April of this year. We want to get to at least 75% of the ambulatory providers in the state, which number about 2,000 to get connected to Connie. Skilled nursing facilities, we have a very small number connected, and we want to get to at least 75% of those. So ultimately, at the moment, we're about 30% of the way connected to those provider organizations, and our goal is really to get to that critical mass.
Thank you.
You're welcome.
Any other questions? Thank you everyone for coming. We appreciate your time and hope to see you again soon. Take care.